No one thinks that this is easy, and no one thinks that this is fair in how it's hitting. This virus is not fair. This virus disproportionately hits people of color. Our black communities are twice as likely to get sick and be in the hospital. And no one thinks it's fair in the businesses that it hurts. Our hospitality industry is predicated on creating wonderful atmospheres where we're close together, sharing exciting times for long periods of time. That's not fair that the virus makes that the place where it spreads, but it's a reality. We've done this, Minnesota. We've done it before. It wasn't easy. It was incredibly hard. In the spring, you were asked and you responded. And just to be very clear, for those that want to know if it makes any difference, it made all the difference in the world to quite literally hundreds, if not thousands of Minnesotans who did not get sick and did not die because of the decisions that you made, that you chose to do to protect them. So our frontline workers are now getting the PPE that they need. It's still a bit of a challenge, but we've gotten so much better at it, and it's there. Our hospitals have been able to understand and manage their demand and create surge capacity. We can double and almost triple our capacity in 24, 48, and 72 hours if we can keep our workers in place. And Minnesota is now a national leader in testing. We brought the testing lab to Minnesota. We've expanded it. At one point early in May, I promised you I would get us to 5,000 tests, and I was asked, who's responsible if we don't? And I said, me. We are now at the capacity to test 75,000, and we're regularly testing over 50,000 people a day. The reason this is important is it lets you make an informed decision to not infect others. It lets you understand where you're at and to self-quarantine to break this spread. So the virus did stay under control. And national folks were wondering, why did Minnesota stay at about 5%? We didn't drop below it, which I sure wish we would have, but we stayed at about 5%. And the fact of the matter is, when we look at mobility data, some of the mask wearing and the mitigation, many of you did what needed to be done. But it's here now. As I said, we were 21st while our neighbors were 1, 2, 3, and 4 in infection rates. We've now moved into the top 10. So we are at a critical point, and it's time for us to do it again. So this pause is what we're going to ask you to do. It's going to start at this Friday at 11:59, and it's social gatherings with other households. Don't bring other households in. And this is I have a big family. We do a lot of things together. That's not going to be possible. It's immediate family. We're going to stop in-person dining. But I want to be clear, and I'll stress this a little more later, order out. Make sure we're spending money locally in these businesses. Make sure we get there. But by setting inside right now with the amount of community spread we have, we're not going to get a handle on this unless we take a pause on it. The next ones are tough. Fitness centers and adult and youth sports. And I want to speak to those folks out there because it's a passionate group of people around youth sports, and I feel like I'm right in the center of that. Those of you who've heard me say this, my life is about coaching and being around it for decades. I've got a 14-year-old whose greatest excitement of 2020 was he made his team, and he was going to be on a team with some others to be able to play here during the winter sports. And now he's not going to be able to do that for a few weeks. So I understand it's not easy and it's not fair, but it's a sacrifice that we need to make. If we don't do that and we continue this spread, we will with absolute certainty put our hospitals at risk and those that need the care as well as the care providers. Places like bowling alleys and bingo halls and theaters will need to take a pause. Receptions, private parties, and other celebrations, the same thing, and outdoor events and entertainment. Things where we gather in large numbers, even outdoors if we're going to do it. Now, with that being said, we've learned much. We know ways to control this, and we know what doesn't pose as high a risk, but gives us both economic, physical, and mental well-being if we participate in those activities. So here's some of those things. Schools are still following our safe learning plan. It's working. We know we're dialing back. My son's in distance learning. I trust the superintendent and I trust the decision makers in the St. Paul Public Schools, just like many of you do across this state. Where it makes sense, we need to have those kids in the classroom, but they can't be there if their teachers are sick because we have community spread. So we need to stay in that distant learning place or a hybrid model, or when we get a handle on this, back in that classroom. Childcare providers will remain open. When this is all said and done, and the stories of this 100-year pandemic are written, there will be heroic stories written about childcare providers who did everything they could to make sure that first responders made sure that frontline workers and made sure so many of us had a place of safety, well-being, and growth in the middle of the pandemic with childcare providers. You can go get groceries, you can shop for the holidays, and you can get takeout for supper, which I certainly encourage you to do if you can. Places of worship are not impact. I want to tell you, I spent the afternoon calling our faith leaders, and they know it's the job that they do to administer to the spiritual, the physical, and the mental well-being of their parishioners. What they understand is that basic freedom to be able to worship. They understand, and we understand how important that is. But they also understand and are sending the message that taking care of our neighbor and keeping our neighbors safe is the highest calling in any of our major faiths. We understand that treating our neighbor with that respect is at the center of most of our most cherished beliefs in our religions. You can still go get a haircut if you need one, and we encourage you. You can go outside. When it was golf and we figured out, or it was running outside, or it was boating, it may be cross-country skiing or walking in the woods. Encourage you to do that, but don't do it with other families and don't do it close together. We encourage you to wear masks, social distance at all times. So Minnesota, I'm asking you to do something that should never have been asked of you again. And I want to acknowledge very, very clearly what's being asked is hard work. To those small business owners, we need our federal partners to step up and provide the relief necessary. You are doing a public service beyond anything that should be ever asked of you. By closing your doors and putting your financial well-being at risk, you are protecting the lives of your neighbors. In this country, and so many across the world did it, and we need to do it again, we need to have a stimulus that provides those small business owners, especially in the hospitality industry, the help they need. And to the workers who are out there who are worried about paying your rent and moratoriums on this. We need the United States Congress and the current administration and the incoming administration to work together to come up with a plan to help us on this. This is unanimously agreed on with no partisanship whatsoever amongst this nation's 50 governors. We have sent letters together. We have appealed to them and asked. So I can tell you, I will continue to fight for that both here at the state level and at the federal level to make sure it gets done. And it's not going to be easy. These numbers are hard. And as I already told you, this lags. What is so heartbreaking about this is I know that hospitalizations are going to continue to go up for the next few weeks, and I know that the death numbers will continue to go up for the next few weeks. But the bright spot of this is the moves we take now will start to bend that at just the time when the potential for a vaccine is coming. That's what's different, Minnesota, this time. I heard a nurse the other day was with me, and she said, please stay home over Thanksgiving so you're not celebrating New Year's with me in the emergency room. And I was up in Moorhead with a firefighter and said, you know, Governor, I really didn't think this was this serious. I followed the rules. I had a little gathering in my garage, and now I'm a long hauler, and I can't get over this and can't go back to firefighting. The other day, I was going to have a young family with me to talk about their 13-year-old son's fight with COVID. On that very day, he was readmitted back to the hospital. These are challenging. And for those of you that are worried financially, I hear you. I hear you. This is incredibly painful. It's incredibly challenging. But there is that news. This is different than the spring. We have better therapeutics. We are better prepared for it. We have the capacity, if we help our hospital systems not be overwhelmed, to make sure everybody gets that care and reduces the death rates. And we had something that was hard to even imagine back in March. We've got a light at the end of the tunnel. I believe with every fiber of my being that there is an incredibly strong possibility, more like a probability, that we will be vaccinating people before the end of this 4-week pause in our long-term care facilities and our frontline healthcare providers. And Minnesota is ready to go through and roll out that vaccine plan to the rest of us. We can do this, Minnesota. We can get this right. We can save lives. And this time, the end side of this is, by the time those trees are budding out again and by the time the Twins bats are cracking, we've whipped this thing. The idea of setting in that stadium on a warm April day and watching the Twins play while you eat a hot dog and talk to your brother-in-law and your next-door neighbor who are decked out and talking maybe without a mask. The ability to be able to do that lies within us. If we don't get this right, it drags on. If we don't get it right, there's going to be Minnesotans like the 3,000 plus already who won't enjoy that Twins game. So we've got the chance. What's always pulled us through this is our grit, our sense of community, and our belief that it matters what we do can positively impact our neighbors. So I'm asking you one more time, Minnesota, let's pause some of the social stuff. Let's be smart. Let's mask up. Let's get through these next few weeks, and let's get to the point again where we can celebrate the things that we really care about. Thank you, Minnesota, and have a great evening.